It is very important to prevent all pregnant women from danger, both the pregnant women and their babies. And to do this, there are some things that must be considered. There are some what we call danger signs that we need to note, do a checklist to ensure that the women are not having these signs or these symptoms, so that you are sure that your pregnant woman and her baby or babies are not in danger. I am Dr. Besem AB, and subscribe to this channel to have more content on health. So today we're going to talk about danger signs in pregnancy. Danger and signs were defined in the previous video. Go down and watch that video. So danger signs in pregnancy, these are signs and symptoms that when we see both the pregnant woman or those who are taking care of her, we need to rush to the hospital for immediate care. So I want to make it very simple so that everyone can remember. Both the child of 5 years old can say ABC, should be able to remember these things, so that if she's left at home alone with the mother, she'll be able to take care and call any emergency number. So starting generally, number one, dizziness or fainting. So if you feel dizzy, your head is, some people express dizziness as they feel as if their head is light, they're lightheaded, they feel as to sit down, they cannot stand unsupported and so on, or if she collapses, rush her to the hospital immediately. Second, if her body is warm to touch and is confirmed by a temperature measured with a thermometer of 38.5 degrees Celsius and higher, it is very important to rush her to the hospital. To address the third point, we'll assess it from head to toe. So beginning with the head, it is said that as a man thinketh, so is he. So our thoughts are very important. If you realize that you're having thoughts of harming your baby, suicidal thoughts, either of harming yourself or of harming your baby or harming both of you, it is very important to consult very urgently. Your mind can make you take on actions that you regret. So if you have any thought, you feel like harming yourself, harming your baby, or harming any other thing, it's very important to consult. Secondly, still on the head, that will lead us to the fourth point. We have headache that does not go away. Sometimes you have headache due to the fact that you're dehydrated, you do not drink water, or you're stressed. But you avoid stress, you rest, you eat, you drink water, you realize the headache is persisting. This may be a sign of preeclampsia. So it's very important to get checked, your blood pressure and so on. Moving down to the mouth, we have nausea and vomiting through the mouth. That will be the fifth point. If you realize that you are having excessive nausea, anything makes you to feel as you throw up. You throw up excessively and even leads to body weakness. It's important that you should consult, because it's normal during the first trimester. Some people have nausea, but in extreme cases it's called hyperemesis gravidarum. It's very important to consult, and it's the doctor that will make the diagnosis and know what to do next. Moving down to the sixth point, which corresponds to the chest. If you realize that you have difficulty in breathing, or your heart, you're having palpitations, anything that concerns the chest, both your lungs and your heart, is very important for you to consult your doctor. Do not try concoctions. Do not try things you're not sure of. Consult your doctor so that this issue is going to be diagnosed and handled. From the chest, we're moving to the seventh point, which is the abdomen. The abdomen will split into 2 points. The seventh point here, we have severe abdominal pain, especially if it's not time for labor. Usually women are about 37 weeks, that's their term. It's normal for them to get into labor anytime from there. But you are not up to 37 weeks or having severe abdominal pain that does not go away, please consult immediately. Going to the eighth point, if you realize that your baby who used to have frequent kicks, when you're bathing the baby is kicking, when you're lying and the baby is kicking, and now you know you're giving birth to a footballer, then all of a sudden you're going 24 hours and there are no kicks. It's very important you consult immediately. It is better safe than sorry. Even if the baby is okay, better consult and be reassured. We're moving to the woman's skin. If you realize that there's bleeding, pregnancy and bleeding do not have any relationship except the mucus plug that comes when you're about entering into labor. So if you spot blood, any clot, any drop, rush to the hospital for checkup. The 10th point, if you realize that there's fluid coming out from your vagina, it's important to get checked up in the hospital. It's what we call premature rupture of membrane, especially when labor has not started. It needs to be addressed immediately. Get checked up. Do not do guesswork. Do not go behind. Do not go anywhere else. Just go to the hospital. It's just that pregnant women cannot run. I would have said you should run to the hospital. But let the bike, let the car, let the bus, let the train, let the plane, let any means of transportation do the running for you. Rush to the hospital and get checked up. Also, if you have any symptom you're worried about, even if your body is itching, Even if the heat is too much and you're not comfortable, go and consult. If there's nothing, your doctor will tell you, and it's better safe than sorry. I hope none of these symptoms are going to be missed. I hope they're not going to be ignored, because I believe that you're with your pen and paper, jotting down everything and putting it in your wall, putting it in the parlor and everywhere, so that if you see one of those symptoms, you are rushing to the hospital. I wish you a safe delivery, and until next time, ciao.